name's Amanda Riddle. I'm with UTA Nursing School, College of Nursing, and today I'm going to be doing an education demonstration about how to set up CRRT on our PrismaFlex. So first we're going to get started with our learning objectives. So our first learning objective is the student will be able to state supplies needed and how these supplies, how to use these supplies for CRRT setup. The second learning objective is the student will be able to demonstrate correct setup for CRRT machine and pass the prime filter test, along with understanding the different functions and why it's important. The third objective is the student will be able to successfully return the patient's blood when therapy is complete or if in an emergency. Okay, so some of the supplies that we need is the consent for CRRT, which is very important, the PrismaFlex machine, we have our filter here. We'll need some lab work, some 3 liters of saline, let's see, a Y adapter, some syringes, needles, flushes, citrate and calcium chloride if the doctor's ordered, and that'd be on your order set, and replacement fluid, dialysis fluid, and then your documentation forms. So this is the physician order form that they'll fill out and you'll use to direct your therapy. Okay, so we're going to go ahead and get started, and I'd like to introduce you to our patient here, and this is Mr. Sim, and he has a dialysis catheter in his neck here, and we have the red port and the blue port they'll be using for CRRT setup today. Okay, so now I'm going to show you the soft pods on the setup machine. So it's a touch screen, and each pod will tell you what's your next step. So we'll go through all of these until we're ready to load the filter. All right, so now it's all loaded and we're ready to prime. So we're gonna hit confirm, and we'll hang our bag of saline and all of our fluid bags here at the bottom. And once again, we'll do our pressure, our little soft keys, go all the way through, and then we'll hit continue, and we're ready to prime. And the prime process will take a few minutes to complete. Okay, so now I'm going to show you, this is what it looks like loaded, and I'm going to show you some important features. One of the most important features is these pressure pods. They come off and pop on. This is our deaeration chamber where any air may escape before returning back to the patient. So this is important to have exactly set up as the options there tell you to. Okay, so the next thing we'll do is we'll push the load button and let it load. Now we have our instructions here on how to connect our patient. It's the soft keys again, so we'll clamp all our lines and we'll disconnect our access line, which is our red line here, and we'll hook it up to our red line on Mr. Sim, and then our return line and hook it to Mr. Sim again, and all of our other fluids are already hooked up and ready to go. After that, we'll hit continue, and we'll verify our patient connection is good, and then we'll hit our start button. This is a video of a patient actually on CRRT, and this is our screen, all of our access pressures we look at. This is our numbers we look at hourly, our flow settings. And we go to history, and this is what we use to do our calculations. This is the machine running, and the bags. Now we're ready to unload our filter. So we'll push our unload button here, and we're going to confirm that everything is clamped. Unload, and it's going to unload our filter here. Once it's finished unloading, you're all done. You can throw everything in the biohazard bags. Okay, thank you for watching my video. I hope you've learned a little bit about the setup of CRRT and everything that goes along with it. I hope you have a good day. Thank you.